I would like to welcome Dr. David McIntosh to the Doc Podcast.
For the first 10, 15 years of doing this gig, I was convinced that all I had to do for these kids is take out their tonsils and adenoids and they were cured for life. We know that kids turning up to an ENT clinic with breathing problems, the malocclusion rate's 60%. We know that kids turning up to an orthodontist, the airway problems, it's 80%. Pediatric sleep disordered breathing, it's far more common than asthma and diabetes in the pediatric population combined. You've got a breathing problem and you've got a sleep problem. That's actually two problems, not one. And collectively, that's really bad for brain development. The younger it starts, the worse the long-term outcomes. These children are having trouble with their learning, their behaviour, their concentration, their emotional regulation and the like, years and years after they've so-called outgrown the condition. The kids that were found early and fixed early did the best. I think from the orthodontic point of view, I think the problem comes down to dogma and mindset. By acknowledging that there is an airway problem in association with an orthodontic problem means having to revise what you were taught and what you've learned. And that's a challenge when if you've been doing it for 20, 30 years and just become, this sort of movement of airway orthodontics that, saves people's lives. CPAP doesn't fix anything. Right. As soon as you stop your CPAP, your disease is still there. The way I look at it in terms of treatment planning these cases is that there's two stages in this person's life. The first stage is while their jaw is growing, and the second stage is where their teeth then end up down the track. You want to optimize the jaw young and early. People say, oh, well, that means it's two lots of orthodontic treatment. It's just like, well, yeah, but they're for different reasons. One's for the jaw and others for the teeth. If we do this primary stage of treatment, the secondary stage is going to be a lot easier because I'm going to be working with a much better canvas down the track versus leaving this all to, try and salvage when I don't have the room. To say that a monotherapy doesn't work is kind of like stating the obvious. If you can get in early and improve those jaws, then at least you're creating a better opportunity for saving the teeth. Why are we waiting for these people to be so bad that they have obstructive sleep apnea, they have high blood pressure, they have diabetes, and they've had a car accident already? You know what? Enough's enough. We've got enough science, we've got enough knowledge, but we don't have enough permeation into the public mindset. The difference between crazy and genius is time.